Hello, and welcome to the 73rd Bi-Monthly Breastfeeding Coalition's webinar. Today's topic is Everything You Need to Know About the 2019 NBCC. I am Adilene Robinson, the Member Relations and Administrative Coordinator at USBC. And on behalf of today's panelists, we are very excited to share with you the details about the 2019 National Breastfeeding Conference and convening. Next slide, please. There it is. Thank you. As you know, this bi-monthly series, also referred to as a 222, is jointly hosted by the USBC and by the CDC's Division of Nutrition, Physical Activity, and Obesity. The webinars are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern Time. Next slide, please. Now to web meeting logistics. To help maximize our time, please make sure audio type on web control panel is set to either computer, audio, or phone call, depending on the method that you are using. Please mute when not speaking on phone or computer. If using a phone, enter your audio pin so we can identify the speakers and background noise. If you already joined the call, you can still enter the pin number. Next one, please. For those of you connected with computers, text chat is available on webinar control panel. We have set aside some time throughout the presentation to answer any questions you may have. We encourage you to type in your questions during the webinar, and here's how you do it. Go to the GoToWebinar control panel on the right side of your screen. If you don't see it, it may be minimized. Click on the orange tab and it will pop back out. If you scroll down below the audio section, you'll see the tab for questions. When you click on it, it will open up a box for you to type in. If you have any webinar-related problems, please send an email to coalitions@usbreastfeeding.org, and one of our staff members will assist you. Next one, please. The NBCC team would love to know about you. Please type into the questions box your name and the organization or coalition that you are representing so that we all know who you are. Thank you. Welcome, everyone. And now, so you can also know about us, Kinkino will happily introduce the NBCC 2019 team.
Great. Thank you so much, Adelene. I am delighted to introduce today's presenter. And as you can see, we have a bunch of staff team members as well as our key liaisons going to be sharing today, and each one of us is coming to you from a different city, and our presenter group demonstrates the power of virtual collaboration, which is so central to USBC's functioning. Adelene Robinson, that you just heard, who you just heard is USBC's Member and Relations and Administrative Coordinator and is working for a few weeks from Basel in Switzerland. Camille Abbey is our Events and Public Relations Manager and is joining us from Maynard, west of Boston in Massachusetts. Danae Schmidt is USBC's Member Relations and Operations Manager and is presenting from sunny San Diego in California. Miriam Rodriguez, our Coalition's Relations Coordinator, joins us from beautiful Mexico City. Sarah Waltz, USBC's Communication and Program Coordinator, is presenting from Chicago, Illinois. Cheryl Lebedevich, a Senior Workplace Program Manager and Policy Analyst, is joining us from Cape Cod in Massachusetts. And Carol McGowan, the Acting Deputy Nutrition Branch Chief at CDC's Division of Nutrition, Physical Activity and Obesity, DNPAO, which co-hosts the webinar with us, will be sharing updates. Carol is our astute strategist, BF breastfeeding champion, and a guide and friend to so many in the first food field. And Carol will be joining us from the CDC headquarters in Atlanta, Georgia. And I am joining you from Mumbai in India. Next slide, please. So we are so thrilled to be here to share about the NBCC. Every year, we strive to make the National Breastfeeding Conference a memorable learning and networking space for our vast network of state and national stakeholders. We are fortunate to have the time and talents of an exceptional conference program committee, which is guiding the design of the 2019 NBCC. This committee is co-chaired by Titina Sanders-Bay, who brings a wealth of grassroots experience in maternal and child health and represents the Healthcare Consortium of Illinois. Our other co-chair is Stephanie Carroll, the founder and president of the Appalachian Breastfeeding Network. Stephanie is a recipient of USBC's Emerging Leader Award for her vision, passion, and commitment to the families residing across 11 states that span the Appalachian region of the US. Next slide, please. And this is our fabulous 2019 Conference Program Committee. The Conference Program Committee, or CPC as it's called, is one of our key committees and part of USBC's host team, along with our board, staff, and the Equity or Crash Committee. So as you can see, the committee members represent national nonprofits, state, tribal, local coalitions, community-based organizations, and bring their priorities and perspectives from their stakeholder groups in the design of the convening. So with that, I'm going to pass it over to Camille, who's going to share a little bit about the nuts and bolts of the conference. Over to you, Camille.
Thanks so much, Kinkini. I love that we can work together even when you're far, far away. So the NBCC 2019, what is that thing? What does that mean? The National Breastfeeding Conference and Convening is what the NBCC stands for. You may recall that in the past it was the National Breastfeeding Coalition's convening. And what we decided to do was to slightly tweak the name because it really is not quite accurate to just call it a coalition's convening. We have stakeholders, from governmental agencies, we have national nonprofit organizations, we have state coalitions, cultural coalitions. It's just runs the gamut in the first food field. And so we really thought that changing the name slightly would better reflect the inclusion of all of our participants. So it's still the NBCC, but NBCC is National Breastfeeding Conference and Convening. And in 2019, next slide, please, we will be hosting it in June. So this is a pretty big change. As many of you might recall, we have been surveying our attendees in the past and heard from many, many folks that there was a lot of interest in moving the NBCC out of August. There's so many activities in August because of National Breastfeeding Month, local state activities, and it just was feeling really challenging for many of our stakeholders to be in attendance with us. And so we got a lot of feedback on a survey and a webinar that we conducted about a year and a half ago now, I think, if I recall correctly. And we received a lot of feedback that June would be a great month for us to host in. So we will be hosting in June, Friday and Saturday of June 14th and 15th. And the reason that we are on Friday and Saturday, this is also a change for us. As you recall, usually we are a Saturday-Sunday event, but Sunday, June 16th, is Father's Day. So what we decided to do was host the event on all-day Friday and a three-quarter or half-day Saturday, ending early, so that folks could travel home if they're, participating or hosting anything for their fathers, their partners. We certainly also welcome fathers, partners, dads, to come and be in DC with us. So, the event is inclusive and welcome for everyone who wants to participate and stay. Some folks may want to stay in the DC area for Father's Day itself. At least that's an idea that we had as a possibility. But certainly everyone will be able to get home on Saturday if that is what they choose to do. And if they're not celebrating Father's Day, certainly it's sure nice to have Sunday off before going back to work on Monday again. So that is the when. We'll be in June and we'll be mid-June, and slightly different dates on the Saturday and the Friday and the Saturday. Next slide, please. So that brings us to where will we be? You've already heard me say DC. So we're just outside of DC in Bethesda, Maryland. We'll be at the Hyatt Regency in Bethesda. There are 3 airports. I like to really highlight this because there's a lot of convenience in being in the DC area, as many of you already know. Reagan Airport will be our sort of closest hub airport, Dulles, and as well as Baltimore. So 3 airports, depending on where you are in the country, to serve you with the most convenient prices. And then, of course, considering ground transportation. This hotel sits on a metro line that is accessible from Reagan Airport. So certainly this might be the easiest for many people and the most cost effective. It's a couple bucks and 35, 45 minutes from Reagan on the metro, a little bit less if you elected to take a taxi or an Uber. And the Hyatt Regency was just recently ranked the best hotel for out-of-town guests by the Bethesda magazine readers, which I thought was really kind of fun and reassuring. So nice for all of us to be hosted in the best of, and certainly very convenient to DC as well, because again, we're right on the metro line or directly above. With that, I think I am going to pass over to Miriam.
Yeah, thank you so much, Camille. Now that we've went over the what, where, and when, I will be going over the who of NBCC 2019. And I might
have skipped a slide. I apologize. I was thinking I was finished. If you want to jump back a slide, I can go through the agenda. Sorry about that, Miriam. That's my mistake. So just to do a quickie on the schedule, everyone, Wednesday, June 12th would be Advocacy Day at the Capitol. So I was so excited talking about the convenience of how great it is and easy to get into DC that I forgot about this slide. So we will be having Advocacy Day back at the Capitol, as we often do when we're in our DC or Crystal City locations. That's going to be on Wednesday, June 12th. We'll be taking the metro in and out, so we won't have to do the bus journey altogether. We'll have a later start, so if folks wanted to come in on that morning, leave their stuff at the hotel, their luggage, they could certainly travel with the group down into the Capitol, and then it'll be an early ending day. So again, allowing time for anybody who wants to stay in town to stay in town and then come back out in the evening at their leisure. So it'll be a nice, a really empowering day, and we really hope to have a high level of engagement. On Thursday will be the USBC membership meeting day, and then on Friday will be the first day of our convening, with again Saturday being a shorter ending day. So there's a flow of days. Again, the conference itself is Friday, Saturday, with Advocacy Day and membership meeting happening in advance of that. Sorry, Miriam, now I officially would like to pass it over to you.
Thank you so much. So with all that information, the next slide is going over who we would love to join us at the NBCC 2019. So we hope all of you will join us, and this conference will be bringing together breastfeeding-focused representatives from all over the country. This includes coalition representatives from every U.S. state and territory, representatives from relevant government departments, national nonprofits, non-governmental organizations, including consumer or parent groups, and health professional associations. Next slide, please. So we're really excited to be presenting a plethora of awards this year. The application deadline is set for February 15th, so be sure to apply or forward this information to somebody you know. The 3 categories this year are Emerging Leaders. 2 to 3 awards will be presented. The Tribal Trailblazer Award, which 7 to 8 awards will be presented, and this award is limited to people of Indigenous heritage. And new for 2019, we have the Cultural Changemaker. We will be presenting 4 of these awards, and please be sure to read the requirements of each award before you apply. Awardees will be receiving complimentary registration to the NBCC, hotel and travel to the conference, and incidental costs. And now I will pass it on to Kinkini, who will share the 2019 NBCC theme.
Thank you, Miriam. So as you know, the NBCC is a really unique event, and it differs from traditional lactation conferences as it does not focus on enhancing clinical lactation skills. Instead, this convening emphasizes leadership development that contributes to racial and health equity. So the goal of USBC's staff team and the conference program committee is to create a networking and learning space where advocates, practitioners, movement makers can come together to heal, recharge, and then build solidarity for action. So we really look at the evaluations from our past conferences, the suggestions you give us, and the insights you share with us during the many networking calls that USBC hosts, as well as our webinars. So we actually go and read all of your feedback, and though that is invaluable to us, the conference program committee went through a pretty rigorous process, sifting, filtering, distilling the essence of what the learning arc of this multiracial, multi-generational convening needed to be. Like, we wanted a leaderful movement. We wanted to build momentum for movement building. We wanted to make sure that equity was central. So the theme, the 2019 theme, was finalized based on the capacity building priorities identified by and for the first food field. And I'm thrilled to share with you the theme for the 2019 NBCC, taking equity from theory to practice, advancing inclusive and collaborative breastfeeding support. Our conference program committee feels so strongly that we are ready to take that next step in our equity journey to normalize an equity, operational equity, to normalize and operationalize equity. How do we build those internal and external focus strategies to advance health equity practice? What is the kind of truly inclusive collaborative work required to transform the systems from within so that we can, as a nation, close the breastfeeding disparity gap? So the 2019 NBCC will be a space where we can harness the wisdom of the field and generate solutions. It will be a space where the voices and wisdom of stakeholders of color will be affirmed and amplified. And it will be a space where every participant, wherever we are in our ability to advance health equity, will feel welcomed and find opportunities for collaboration. I'm now going to turn it over to Danae to share how we will be learning, connecting, and gearing up for action at the NBCC.
Thank you, King Kenny. So we've heard a lot about the what and the where, and a little bit about the why, and now I'm going to share a little bit about the how. So our annual conference is really a vital part of our collaborative work with our stakeholders in the first food field. It's really the zenith of the virtual learning and collaboration that happens throughout the year. And as our one and only in-person gathering for the larger group of stakeholders in the breastfeeding field, our goal is to have you learn something that you can take back to the moms and babies that you serve, connect with other breastfeeding advocates, and really feel equipped to take action at the national, state, and local level. So similarly to last year, the 2019 NBCC will have whole group learning sessions as well as learning through peer sharing. The 2019 call for proposal announcement will be released later this week with the opportunity to submit posters, table topic discussions, and breakout panel sessions. We encourage anyone who's interested in submitting a proposal to read the call for proposals guidelines and also watch the brief tutorial on how to submit a proposal through the online system. The deadline to submit a proposal will be January 31st of 2019. And the USBC team heard your feedback. We wanted to let you all know that we are applying to several agencies to provide continuing education units to our attendees this year. And with that, I'm going to turn it over to Sarah to share more about the how you can connect and take action at this year's NBCC.
Thanks, Danae. So in addition to sort of the whole group learning that we are so excited to foster from the field, we'll have a variety of side events associated with this year's NBCC. So one thing that we have heard many times from our participants is that not only do they want to learn, but they want to connect and have that really valuable in-person networking time with each other. So we are building that in very nicely into our schedule. That will include a variety of the things that you see on here, as well as maybe some other things that we cook up over the next couple months. But it will always include folks can connect with each other, with people that are closer to them back home. We'll have Identity Caucus facilitated conversations. Last year, we were so excited to offer childcare for the very first time at NBCC, and we will continue to do that. So please bring your babies, your toddlers, your children with you to the conference, and we will make sure that they are taken care of while you are learning and connecting. We have, for the past couple years, had a story sharing evening, so we will continue to do that. And of course, there will also be exhibitor and sponsor opportunities for organizations. Additionally, a really big bonus of moving back to DC this year is that we will once again have our Advocacy Day of Action. Just to be clear, it will not be as cold as it was when our interim executive director, Amelia, took this selfie at Capitol Hill a couple weeks ago. It will be much hotter. So an exciting thing about this, Camille kind of already talked about the schedule of it. So it'll be a 10 a.m. metro departure from the hotel. We won't be doing a bus. We won't be doing kind of all of that more complicated things. We'll just get on the metro together and go down to the Hill. And it'll be a shorter day, so that it can be a really flexible start to your NBCC experience. So it can be a little bit of advocacy in the morning and maybe a visit to a Smithsonian museum in the evening or an evening monument tour, whatever like works well for your schedule and energy. We'll have a webinar to prepare attendees beforehand. And I am really excited to have an advocacy day in June. When I started with USBC, Advocacy Day was the first project that I worked on. But in the past, because our conference has been in August, it's always been during a recess. So this will be a really exciting time to visit when Congress is in session and be able to meet with congressional members and staffers and talk about all the exciting breastfeeding policy that is sure to come in this new Congress. So it will be a very, very exciting day of action, and I hope that you can join us. And with that, I'm passing it back over to Janae.
Thanks, Sarah. So we really hope that you all will be able to join us in DC. We're extremely excited to return there this year. Again, it's a great time of networking and connecting with folks from around the country. It's also a really great opportunity to show off your amazing work. So please make sure that you submit a proposal for this year's conference. And I'm turning it over to Camille to talk about our Save the Date.
Excellent. Next slide, please. So we have a few different things that are worth mentioning to folks as far as date saving. The first thing is, of course, the call for presentation proposals deadline. That deadline is January 31st. So it is only the 11th of December. So you'll be hearing from us via a lot of different outlets about reminders on that date. We know how busy everyone is at this time of year, but we really wanted to put it out early, open it up, and you'll hear from us. The call for presentation proposals will be open any day now, likely this week. So just you'll see the note and you'll hear from us at various times, but we wanted to let everyone know that the invitation is forthcoming, and that the date for that will be the 31st of January. For awards, as you know, we have a lot of awards that we're offering this year. The application deadline for that will be February 15th. So there's a little bit of extra time. And, obviously, planning ahead, booking flights and hotel, that can happen at the start of the year, whenever you know who is going. If you're in a coalition, which member of the coalition or organization who might be coming, or if you're an individual, of course, speaking for yourself. So registration will open in March, or will open in March, but just a reminder to sort of think about that of March and April. So it's a very different timeline than we have had in the past with our August convenings. So just bearing that in mind. If you could go to the next slide, we have a few ways to help us all keep those dates in mind. One of which is, if you go to our Facebook page and follow the event, you'll receive the updates right into your feed. So when we post something, reminders or call for presentation proposals is live, all of that will go right into the Facebook event page, which is already live. So that is the usbreastfeeding.org, NBCC hyphen FB Facebook. So you can also bookmark the NBCC webpage on our website, the USBC website, which is usbreastfeeding.org/conference. So that is up and there. There's not a lot of content in it just yet, but we do have the dates and save the date. So if you bookmark that, then you'll know where to go and look. Just other reminders, reminder to folks to update, please, your USBC profile, your individual profile as well as your organizational profile. It really helps us know how to find you, but also you find each other, seeing what interests you, what topic areas you yourself or your organization or coalition are working on. Just keeping that up to date. If anyone is no longer with your organization or coalition, just switching that out, making sure you go through the channels to update so that we know who the best people to reach out to are, so that no information gets lost out in the void. And again, as I mentioned already, just having everyone start thinking about who will participate in June. So it would be really helpful. Sometimes we've heard in the past, we're just not sure who's coming, and it's really close to the event, and we've always been in August. And so now that we're pushing the timeline a little bit sooner, we want to make sure everyone has a lot of time to start thinking who might be able to come and participate and represent the organization. And that may certainly be informed by the call for presentation proposal. So whether you have someone presenting a poster or a table topic discussion or in a panel conversation, we understand that may inform who actually comes, but just to start thinking about that is always helpful. I think that I am passing this along now to Danae. I think you're going to run a poll for us.
I sure am. So I do want to encourage you all to send your questions, any questions that you may have for the NBCC team about the conference that's coming up while we run this poll. So the first question is, have you ever attended USBC's National Breastfeeding Conference and Convening? So we will go ahead and keep that open for about a minute or so. So please make sure that you submit your answer. Okay, we're about halfway through, and I also see some questions coming in, so we'll be sure to get to those as well. Okay, I will leave it open for about 10 more seconds before showing the results. Okay. Okay, so it looks like 71% of our attendees that responded have not come to the conference yet. So thank you so much for joining the webinar because that shows that you have some interest, and we really hope that if you have questions about the conference that you send them to us now or in between now and June, and we really hope to see you in 2019. Okay, I'm going to go ahead and launch the second poll. Have you ever presented at an NBCC? So if you have attended, please go ahead and respond to that as well. We've got about 44% of our attendees that have responded to the poll. I'll leave it open for a few more seconds. We at least want to get to half of our attendees that have responded. Okay. Let's go ahead and show those results. So 85% say no, not yet, which makes sense since 71% of you have not attended yet. But of those who have attended, 11% have presented on the breakout panel, 6% during a peer sharing event, and 2% for posters. So those of you who haven't presented at the conference, We really hope that you will not only be in attendance, but will really use this as an opportunity to share some of your wisdom with us. And those of you who have presented, we really hope that you'll be submitting a proposal this year as well. Okay, and last but not least, are you excited to attend this year's NBCC? All right, and we hope that you all are clicking yes. We're about at 47% of our attendees. We'll leave it open for just a few more seconds and hope that if you are joining by computer, you'll be able to participate in this poll. Okay, I'm going to go ahead and close the poll. So 48% of our attendees today are excited to attend the webinar, or not the webinar, but the conference. 28% say yes once they have more information, and 23% are excited but have a few questions. And this is a great time to roll it over to the Q&A session. So I will hand it over to King Kenny to facilitate that.
Thank you, Danae. And yes, we do have some questions coming in. There's one about, there are actually two about, what do you mean by contact person and what do you mean by coalition sponsored? So, Camille, do you want to take that about what a coalition sponsored attendee is?
Sure. Yeah, so what we mean by contact information is for everyone, all of our member organizations, we have member representatives. So there are a number of representatives to the organization, and those people sometimes change when folks change jobs or anything like that. They may change in the organization. Coalitions also have a contact person. So the state, local, territorial coalitions have a contact person. Their poll contact and president are who we reach out to say, hey, reminder, we have funding for some folks to come and attend as representatives from those state and territorial coalitions. So we reach out to those poll contacts. So we always really need each coalition, and whether you're a state and territorial local, coalition, or if you're a cultural coalition, we really want to make sure we have you in our coalition's directory. So I have been personally noticing that we have a few missing coalitions in our listing that are missing information. So whether, some coalitions may not have a website, but they certainly might have a Facebook page, and we may or may not have that information listed. So we want to make sure we know who the best person to reach out to if you are a member of a coalition or any of our organizations, who the best person to reach out to is. So just updating all of that contact information.
Great. Thank you, Camille. And I also wanted to share that through the CDC funding, in all of the years that we've had at the National Breastfeeding Conference, we've supported two reps from each state to attend the conference. So part of their costs, a big chunk of the costs is paid for to attend the conference. And so again, we will be sharing info as soon as before registration goes live about for the state coalitions of, guidelines on how you recruit your coalition-sponsored attendees, but we look forward to having every single state and territory represented at the NBCC. And of course, we are so thrilled that this coming year, we'll also have a lot of cultural coalitions and local county coalitions coming in as well. There was one question about, would this be, a place for WIC state breastfeeding coordinators and WIC folks to be coming, and we so hope so, because this is a big part of what the conference is bringing, is this convening folks together. So how can we coordinate efforts with state and local public health agencies, and how can we integrate breastfeeding into the larger public health and social services initiatives? So yes, absolutely. We are looking at a very multi-sectoral attendee pool this time. We'll be doing a lot of outreach to folks outside of the healthcare, public health sector as well. But yes, WIC breastfeeding coordinators, state breastfeeding coordinators are very a key part of this conferences. We also have special meetings for them as well. So please, yes, we hope you will be coming to the conference. Next, I'm looking at some other questions. Will there be a code hotel rate for reservations? And Camille, I'm going to turn that over to you.
Yes, indeed. All of the information about the hotel and our group booking link will be posted as soon as we post that information up. If I hear questions about it now, that's great, and we'll get that up ASAP.
Fabulous. And then Sarah did share about the Advocacy Day. Well, we do have one question about like what does a typical Advocacy Day look like? So Sarah, do you want to take that one?
Sure.
What does advocacy look like?
Typical Advocacy Day looks like just like the most fun you will ever have talking about breastfeeding, is my biased opinion. But it normally looks like a couple different things. So one thing that it looks like is USBC sort of, once you register for it, will reach out and help you set up if you want to make appointments to meet with your congressional representative. So whether that's your representative or your 2 senators, to talk about breastfeeding in your state, and we'll supply you with some materials about, we usually supply a couple fact sheets that are topic specific with legislation that might have been introduced this session about breastfeeding or other topics. But it also really is just a chance to go and talk to someone in your congressional representative's office and tell them what is important to you, of their constituent, about breastfeeding. And it's just a really great way to connect with your legislator and make an impact on them and show them, the face of a constituent that cares about breastfeeding, which is a conversation that not every legislator has ever had, but they are there to represent you in Congress, and it's their job to listen to you when you talk about breastfeeding. So it could look like an appointment. It also could look like just a simple pop into an office and drop off a packet and get a business card, and then later we'll help you kind of establish contact with them and continue to have a conversation about breastfeeding. So whether it's an initial conversation or a more in-depth conversation, it is just like a really fun day of being on Capitol Hill and walking the halls of Congress, letting them know that your voices are there. And I think this year, because just like so many new people have been elected as representatives, I think it will be a really fun year if you have a new representative to get in there and talk to them about breastfeeding and breastfeeding friendly legislation and what that looks like and what breastfeeding looks like in your state or congressional district.
Great. Thank you, Sarah. We have a request to see the slide with the presenters again before the conclusion, so if someone can scroll to that slide. And we do have a question about if we will be talking about breastfeeding benefits. So I hope I'm reading your question right, but yes, throughout the conference, we will be talking about, why breastfeeding is so core to improving the maternal, infant, newborn, child health outcomes that we as a country lag behind so much. So that is really core of why we do the work that we do and why we need to do policy and systems changes. So yes, you won't hear a lot about breastfeeding in terms of how do you do clinical practice of breastfeeding, but it's all about how do you change advanced policy and systems to make breastfeeding the norm in our country and to improve the rates that we have. So with that, I am actually going to we do have a few USBC updates to share, and I'm going to turn it over to Cheryl Lebedevich for a quick overview of some action items for USBC. Over to you, Cheryl.
Hi, everyone.
Oh, I think we're turning it over to Carol first, actually, before Cheryl.
All right, my mistake. Carol, you're on next. We are ready for updates from CDC.
Okay, thank you. Hi, everybody. What an exciting call. What a lot to look forward to in the summer. I thought this would be a good time for you all around the country to hear a little bit about where CDC did put its funding for what we consider our fiscal year 19, which is October 1st, 2018 through September 30th, 2019. So for those of you that are aware of our Empower training project, we are funding that through this next year. And this is a project that we put into place to address what was found to be one of the major barriers to implementing maternity practices supportive of breastfeeding. And this project has enrolled 89 hospitals, and we are in the process of providing team training to them through a contractor. We also are funding the design and development of a validation evaluation of the maternity practice or in infant nutrition and care, or the MPINC survey. And I'll give you an update on MPINC at the end of my talk, but this contract is going to be used to design and develop a validation evaluation of it. It's a one-year project, and we're hoping that this will help us make sure that when we put the survey out, it is a validated product. We also are we're funding quite a bit of different organizations. We are funding 2 projects with the American Academy of Pediatrics through their section of breastfeeding, and 1 through their Institute for Healthy Childhood Weight. The one that's with the AAP section on breastfeeding is to build on 2 years of work that we've already done with them, and it's to try to improve breastfeeding-related physician education and training. So this work is the work in 2018 focused on developing a plan, and in 2019, this plan is going to start to be implemented. So keep your ears open for that. The project that we're funding through the Institute on Healthy Childhood Weight isn't breastfeeding specific. It is more around the transition to it includes breastfeeding, but it's more around the transition to foods from breastfeeding or in addition to breastfeeding for young children. So I won't go into too much detail about that one. We also have funded for the first time a public health organization called AMCHIP, or the Association of Maternal and Child Health Providers. It has to do with state health department work and local health department work. The ultimate purpose of this project is to increase the capacity of public health department maternal and child health programs to support optimal early child nutrition and feeding practices, which includes breastfeeding as well. So we don't have a lot of detail on that one yet, since it's just being launched. So we can give updates throughout the year on what they're doing. In addition to that, we are continuing to fund the Association of State Territorial Health Officials, or ASTO, and we've been funding them since 2014. They worked with 18 states in the District of Columbia over the last 4 years with a learning community model. We came up with some really exciting innovations as well as progress in those states. They will continue to receive funding. This time, we're going to focus on 16 states that have received funding to implement nutrition and physical activity programs, and these 16 states will be set up in a learning collaborative, just like the 19 that I mentioned before. Then let me see. The other project that we're continuing to fund, is with the National Association of County and Health Officials. And they also have been funded since 2014 and will continue to be funded. And they will be working to provide technical assistance, training, and support at the community level, whereas ASTO is providing support at the state level. So more on that to come as well. And then the last thing I want to give you an update on is the fact that we have funded 16 states and 32 communities with funding to implement nutrition and physical activity, and the 16 states as well as the 31 communities in 21 states are all required to, if they pick nutrition as a strategy, are required to address breastfeeding. So we will be providing technical assistance to all of those. And then finally, just an update, and I know you've seen this on the Weekly Wire, the 2018 National Survey of Maternity Practices in Infant Nutrition and Care, or NPINC, was launched in mid-November. Screening calls are being made on a rolling basis on behalf of CDC by our contractor to all the hospitals, birthing hospitals in the U.S., and make sure that if you're involved with your hospitals and doing hospital work, this is a time to encourage them and to offer any assistance that you can. Just to let you know, these calls to get in touch with the hospitals and inform them about the availability of the survey online for them to complete will continue through the winter. So if you know a hospital that doesn't think they've heard yet, the screening calls will be repeated for the hospitals that didn't get connected with. So just to let you know, because you can be of great help in reminding the hospitals that the NPINC survey is out there and ready to be completed. And I think that is all the updates I have for this time.
Fabulous. Thank you, Carol. And there's just so much that CDC is doing to support breastfeeding in every single state right now. So very exciting time. I am going to turn it over to Cheryl now for an update from USBC.
Thanks so much. Hi, everybody. Our big update is sharing that the Department of Health and Human Services has released the proposed objectives for Healthy People 2030. So just as a quick rundown of what this means, every 10 years, beginning in for Healthy People 2000, we've had a Secretary's Advisory Committee and a federal interagency work group coming together to develop Healthy People, so our 10-year national health objectives. And so the process has been underway for quite a while now to start looking at what objectives will be included in Healthy People 2030. Just a few days ago, those were released, and unfortunately only included one breastfeeding objective. So in Healthy People 2020, we had a total of 8 objectives, including 4 sub-objectives. And they captured both breastfeeding rates as well as some of the policy systems, environmental factors that impact the breastfeeding experience. So it looked at maternity care practices and formula supplementation, as well as workplace support for breastfeeding employees. This year, we were well aware that they were trying to drastically trim the number of objectives. So we were fully expecting to lose some of our objectives, but only having this one was a little bit of a surprise, at least for me. Luckily, there is a public comment opportunity that's open through January 17th. So just as we've done through all past iterations of Healthy People, we want to make sure that the first food field is coming out strongly in support of maintaining the one breastfeeding objective that was included, which is focused on 6 months of exclusive breastfeeding, as well as, asking for the continuation of some of our other objectives. We are going to be publishing all kinds of information and updates in the Weekly Wire, including sample talking points. So there will be support for you if you would like to submit public comments. We're hoping to see as many breastfeeding friendly public comments as we can possibly muster between now and January 17th. And then the next item is, we actually don't have a slide for it, but just really looking ahead, we're in the final days of the 115th congressional session. And even while we want to have a strong finish, we are already looking ahead to the upcoming session, which will begin in January. So right now, USBC has a survey out to try to get a sense from the field and all of the stakeholders that we're so lucky to be able to work with, and really hear from you about what are the top policy areas that we really need to focus on in the coming congressional session. So we'll be able to grab that link and put it into the chat box for you, but we hope to hear from you. And I believe I'm passing back to Danae.
Thank you, Cheryl, for that very, very informative update. So that brings us to the end of today's session. We invite you to fill out the survey. After this webinar, you do get a certificate of attendance for filling out that survey. We also invite you to connect with us via email. Please follow us on all of our various social media pages, and subscribe to our newsletters and action alerts, and make sure that you're connected to us on the various topical learning communities on the USBC platform. So thank you for all that you do. Warm wishes to you and yours this holiday season, and we will see you in the new year. Have a great day, everyone. Thank you.